Thank you, Alexis, for bringing us all together virtually. It's really wonderful to still have this series going, even if it looks a little different. I'd like to start with just a quick overview about e-cigarettes and our youth use of e-cigarettes and vapes. And one thing just to note really quickly is that throughout this presentation, we may be talking about e-cigarettes, vapes, electronic nicotine delivery systems. All of those we're going to use interchangeably. They are a variety of different products, but all of them have nicotine in some capacity that's in a liquid form that is heated and not lit like a traditional cigarette. And I'd like to start off with good news. And the good news is that fewer teens are smoking cigarettes than ever before. So back in 1997, about 1 in 4 teens smoked cigarettes. And in 2018, that was roughly 1 in 20 teens were smoking cigarettes. So there's a lot of progress that's been made. And a lot of that is due to youth themselves who have researched and have heard the truth about the danger of smoking cigarettes and have made the choice to not use those cigarettes. There have also been a variety of policy changes and changes to advertising and things that have also helped with those rates dropping dramatically like that. But we also have some bad news. And the bad news, the reason we're all here on this webinar today, is that teens are vaping at alarming rates. So you can see the latest statistics from the National Youth Tobacco Survey, where it's almost 1 out of 3 teens are using any tobacco product. And you can see the most often used product is an e-cigarette. And you look at how much between the e-cigarette and cigar, the rates drop so much. So most youth that are using a type of tobacco product, their product of choice is an e-cigarette or a vape. And I mentioned that the language is kind of interchangeable at this point, but the products are really varied as well. And so this slide really goes to show how e-cigarettes have changed. They started off, the first generation we called cig-alikes, the ones, they really looked a lot like the traditional tobacco products. So the disposable e-cigarettes, there are even e-pipes and e-cigars, e-hookahs that resembled a lot of the original tobacco products. The second generation moved into these mods, and these are the ones that you buy the liquids separately, you add them to the devices. For the cloud competitions, these typically are mods, and these are ones that you can tinker with in terms of the coils and other products. And then the current generation, the more popular products, of course, Juul is the one that brought our national attention, the Juul use of an e-cigarette and Juul lookalikes. There's Soren, there's Puff Bars, and some of them are rechargeable, but we're also seeing now disposable nicotine salt products that we'll talk about in a bit. But these look a little different. Of course, the Juul resembles a USB and can be charged even right in a computer, and it's hard to recognize those as a cigarette or as a tobacco product. So what these latest devices, what's really different about them is that they have nicotine salts instead of the free-base nicotine that's in a traditional cigarette. And what that has done is it really helps the person to inhale more easily and with less irritation. And so these products were able to add more nicotine because with the nicotine salts, they were easier to inhale. So not only is it smoother, but there are much higher rates of nicotine in these products. So you've probably heard this statistic before, but 1 Juul pod is the equivalent amount of nicotine as an entire pack of cigarettes. So this is another graph that shows that, and it shows over the years how the disposable e-cigarettes, the dark blue line, had about the nicotine concentration of about 3%. And that sounds really low, 3%. It's not 97%. But again, that's the percent of nicotine, and 5% nicotine, the green one that you see here, Juul, is the same equivalent amount of nicotine as a pack of cigarettes. So it sounds low, but it's really not. And you can see how these products with nicotine salts really have skyrocketed to be able to have a higher nicotine concentration. And so we know there are health effects. We are learning a lot about vaping, and you'll hear that a lot in our public health messages, that we just don't know as much as we would like to know about them in terms of long-term health effects, like we have the data for traditional cigarettes. But we do know that there are health effects in the short term. There is acute lung disease. Of course, the cases of lung injury that made the news. It's hard to remember news before coronavirus, but the lung injury that was in the news is very serious and connected to vaping. Mouth and throat irritation, nausea, headaches, dry cough. And a new study showed the flavors and nicotine from e-cigarettes can damage heart tissue and reduce its ability to heal. So these are very concerning, especially for adolescents using these products early in their life. So these are some of the things that we do know, some of the facts about e-cigarettes. FDA is in the process of overseeing these products, but those deadlines keep getting pushed back. They are not risk-free. They are highly addictive. There's so many different products. It's hard to have consistency across the products. They are not a proven method for quitting smoking, which we'll talk about in just a second. They are used frequently in addition to other products like traditional cigarettes, rather than as a replacement for those cigarettes. So even if someone is trying to use a vape to quit successfully, to get off a traditional cigarette, we see they often end up using more than one product. And they may be renormalizing smoking behavior. We mentioned how those advertisements and things have changed over the years, and now we're seeing vaping in advertisements and on shows that are glamorizing tobacco and nicotine use in a way that we haven't seen in a while with smoking. And then, of course, we've talked about the E-Valley, the outbreak of lung disease. That is a real serious concern. And this slide just shows that the aerosol that comes out of a vape still has a lot of different products in that aerosol. From ultrafine particles, volatile organic compounds, heavy metals, flavorings, and cancer-causing chemicals, and nicotine has been found in that aerosol as well. So before we open it up to some of our myth and fact section of this, I do want to say that nicotine, especially in the adolescent brain, can be really addictive. And so if you know anyone, or if you yourself are using these products, we encourage you to get help to quit them, and not just say it's mind over matter, I can quit whenever I want to. In order to reduce the risk of becoming a lifetime user with nicotine, if you get the right support and help in quitting, you're more likely to quit for good. And so I want to just quickly highlight a couple of different resources, and these slides will be shared with you as well. But 1-800-QUIT-NOW is the state's quit line, and it is open for anyone 13 and over. It is on the phone line, the 1-800-QUIT-NOW, or you can go to quitnow.net/Virginia to interact with a quit coach on the web. And parents can also call this quit line for tips, or they themselves, if they use a tobacco or nicotine product, can use this to quit as well. teen.smokefree.gov is a great resource with tools and tips specifically for teenagers to quit any type of tobacco product. And the American Heart Association has partnered with the Truth Initiative. And there is a texting program that can help you quit Juul or Sorin. And if you text HEART to 88709, you can get additional information on that. And what's great about that is they'll even ask you the product that you're using, and will change your tips based on the product that you are trying to quit. So that's my biggest takeaway, is that it is possible to quit, and we know a lot of teens that have quit and are choosing to not use these products, but we do encourage you to get help in doing that. Okay, I hope, does that go back to you, Alexis?
Yeah, so thank you so much, Sarah, for sharing all of this important information. So one of the main things about our learning series is that we want parents to feel like they have education behind a lot of the things that are going on with their youth or that the youth are exposed to. So we want to make sure that you all have the education that you can go back and talk to your children, because your children are listening to you. So we have a fun little true or false game that we want to play with you all. So if you want to give a thumbs up on your screen or in the comments if you think that something is true, and a thumbs down if you think that it is false. So the first thing that we, oh, and I'm sorry, and I also like to say that we do have one of our youth ambassadors and parents on the phone to help. So the youth ambassadors is through Henrico Area Mental Health, and they are a wonderful group of teens who kind of come together to be leaders and examples for their peers. So we do have Ahmad and Miss Felicia on. So I do want to say thank you all so much for joining in with us today to help with the true and false. So our first one, so thumbs up for true, thumbs down for false. E-cigarettes are safer than cigarettes. See what you all think.
All right, can I take it away?
Yes, you can.
This is a tricky one, and so I'm curious. I was curious to see what people would say, thumbs up or thumbs down. And this has kind of been hard, even in the messaging that we're getting. And part of that is because cigarettes are the #1 preventable cause of death and disease. So obesity has been growing, but cigarettes are still, tobacco is the #1 cause, preventable cause of death and disease. So when someone says e-cigarettes are safer, it kind of makes sense for somebody to think that, right? Because it's not #1. However, that safer does not mean safe. There are a lot of things that are not as dangerous as cigarettes that we still do not want people to partake in or to experience in life. And so we know that these vapes do, 99% of them contain nicotine. The flavors can be dangerous, and those chemicals that cause the flavor, you're not inhaling a mango or a banana, you're inhaling chemicals that are designed to taste like a mango and a banana. And that these also, you can be inhaling metal particles into your lungs. So safer does not mean safe. So all those thumbs down, well done.
All right, good job. So our next one, from 2018 to 2019, it was a 48% increase in the percentage of middle schoolers who vape. Thumbs up for true, thumbs down for false. All right, we're seeing a few mixed answers. Dr. Tompkins, would you like to give us the answer for this one?
Yes, and the answer is true. In 2018, more than 3.6 million U.S. middle and high school students used e-cigarettes in any given 30-day period. That jumped in 2019 to 5 million. It was 4.9% middle school students. That changed to 10.5%. And in high school students, it went from 20.8% to 27.6%. So what is happening is that each year the use not only has gone up, but incredibly the age of starting vaping is what is very disconcerting, and that has gone up as well. So we need to make sure that our middle school students as well as the high school students are well educated about the use of vaping and the harmful impact that it has, and particularly for those who have never smoked, because when you have not used a tobacco product and then you start to vape, it's more likely that you may go on to use a tobacco product. So this is the seriousness of this situation.
All right. So next we have vapor is just water. Thumbs up for true, thumbs down for false. All right, we're seeing a little more consistency with thumbs down, thumbs down. All right, Dr. Tompkins, would you like to take this one away also?
Yes, the vapor is not just water. It would be nice if it were, but if you think about a cloud you see with smoking, you actually even get a larger cloud with the vaping apparatus. And it was interesting to me. I was standing in line at Sam's Club to go in during this age of our pandemic. And a young man was walking towards the doorway. And at first I wasn't sure who he was, but it turns out he was an employee of Sam's Club. And I saw him take something out of his pocket, and he apparently inhaled, but I was multiple feet away from him, probably 20. And I could smell the fragrance of the vapor that he used. And I had to explain to my next door neighbor what was going on. And if you think in terms of if we were face to face and you had a spray bottle and we sprayed it on your hair, as an example, we've done that before, and you feel your hair, that's wet, that's pure water. But the aerosol that you would have like in a hairspray is very fine particles. And then you would be able, you don't see it. And when you feel the hair, you will feel kind of a sticky film that's left. And that kind of helps you to understand the difference between a vapor and then what would be a spray, as an example.
All right. Thank you so much for those examples, Dr. Tompkins. So there is a lot that even just as parents, we have to know so that we can be sure to educate our children about. So let's move to some statistics about Henrico. So true or false? Nearly 90% of Henrico's youth don't use e-cigarettes or vaping devices. Thumbs up for true, thumbs down for false. All right, a lot of false. So let's see, Terrell, would you mind taking this one over, Mr. Pollard?
Sure. Yes, 90% of Henrico's youth do not use do not vape or use e-cigarettes. And so I think it's always important to promote positive statistics. So a lot of times the youth think everyone's doing something like e-cigarettes, but most of them are making the right decisions. And so it's important to promote that.
Okay, that's a fun statistic. So next we have nothing that parents say can dissuade their children from trying e-cigarettes or vaping. True, thumbs up, false, thumbs down. Okay, so it seems like we have a lot of false, thumbs down. Terrell, what's our answer?
All right, because I get nervous, I hope she's still on. Miss Felicia, would you mind answering that question? We talked about it a little bit. And so if you don't have the exact specifics, I'll help you out. But is it true or false if parents say can influence whether their kids use e-cigarettes or not? Are you stuck on mute? I see you're on mute. Well,
are you able to unmute?
In the interest of time, I'll go ahead forward. Again, statistics from Henrico's surveys, I think the one from 2016 showed that. Ms. Felicia, are you on?
Yeah, there she
I'm
is.
here now. I got it.
All right. Did you hear the question?
Yes, I heard the question. I think, yes, if parents have open conversations with their children, it definitely can be a deterrent for them not to vape.
Thank you. Yeah, and well said. In 2016, the survey said that parents were over peers. So a lot of cases, parents think that peers have more influence when they actually have more influence. And so to not have those conversations is to kind of forfeit your power. And so it's, yeah, like Ms. Felicia said, it's definitely a deterrent. Your youth care what you think. I'm not sure how they may respond in real time when you say certain things or talk about certain things with them, but it is going in, they are hearing, and they do act on it.
Yeah, so it's definitely important that we have these conversations that we can share out with our youth and with our children. So next, we're going to kind of move on to a call of action from the American Heart Association. And this is just something that we're able to put forth so that we can kind of say, well, how can we all individually help our youth?
Hi, everybody. So I'm Robin Gann with the American Heart Association, and just want to thank you all for your time and attention today, and so much thanks to our partners in Henrico County and Henrico Too Smart to Start in the health department. But your voice is powerful not only in how you influence your youth's perspective on this, but also elected officials. So we'd love to have you join us in calls to action as part of the American Heart Association's You're the Cure grassroots network. So you'll have the link as a follow-up. I'll chat it in a moment here, but we'd love for you to join and take action at the local, state, and federal level.
Thank you so much, Robin. So that is the conclusion of the main portion to our series today. And I would like to pass it over to Ms. Adrienne Cole Johnson really quickly to do a thank you and wrap up. And then we will end the recording and start to answer questions for the Q&A portion.
All right. Good morning, everyone. I am just here to say thank you to our partners for your insight, your information, and just your clear call to action for our parents and for our staff. Alexis, as you continue to work on this, on the family learning series, I feel as though each week we're learning new things. I know I learned a lot today, have been in the dark a little bit about the details of vaping. So thank you all for even the really concrete and just tangible information. So yep, just really a thank you. And now we can even jump over to some questions. I know I have a few, but maybe we can jump to questions for folks who are still on the call.